Hi, my name is Krista Dancy. You're here in my office in Roseville, California, where I'm a licensed marriage and family therapist. And this is 2 Minute Therapy, where I discuss a variety of topics that I discuss with my therapy clients, but I do it in a 2 minute format because who's got time for all of that? I'm going to go ahead and start my timer now. Today, we're going to be talking about trauma. Specifically, what is trauma and what's going on in the brain a little bit. Trauma is defined in a million different ways, but to cut it simply, I'm just going to say trauma is any time an experience overwhelms our ability to cope. So anytime your threshold is here and the experience goes above it to where you start to experience distressing symptoms, that is trauma, which leads me to my second point, which is that trauma is incredibly subjective. Nobody gets to decide what is trauma except for you and you alone. Two people could be in the same car accident. One person could walk away and say, I'm going to sleep like a baby tonight. I'm really glad I survived that one. Where somebody else could walk away, have distressing nightmares, flashbacks, sweat every time they get behind the wheel of the car. There's a lot of reasons why that is, but I will leave that out of the video for the sake of time, just to say anybody gets to decide what their trauma is. No one gets to decide for you. Trauma, what's going on in the brain? Let's talk about that. Again, to cut it simply, there's two different kinds of memory. Ready? So the first kind of memory is I have a yummy meal, it tastes really good, and I can remember every single bite. A very short time later, that memory becomes factual memory. I know I had a good meal. I went to this restaurant. I think I remember a little bit about the waiter, and that's about it. This is the process that we want to happen with any experience. But what we know is something breaks down in that process when it comes to trauma. The memory stays stuck in this emotional experiential place instead of moving into the factual place. So as soon as something triggers the traumatic experience in any way, a sound, a noise, a smell, a word, all of a sudden, boom, our body is reacting as if it is present day. It did not get the memo that this is the past. It can be extreme and severe in cases of flashback or even repeated nightmares, or it can be more subtle in terms of sweat, elevated heart rate, breathing faster and shallow, upset stomach, or even more subtle than that in the emotions where suddenly we're very angry or very aggressive or full of anxiety or feel very hopeless, and it's not really appropriate to the setting. But the important thing is that something's going on in that breakdown, which leads me to my final point. Trauma is highly treatable. We know what to do about trauma. It is easy to treat. It is quick and effective. So in the future, I'm going to be talking about ways to treat trauma, both at home and in the office, and how you can help your traumatized loved ones in their healing journey. Thanks so much for your time with me, and I hope you take what's helpful here and rest.